Welcome, everyone. I'm Brittany Morgan. I am the head of product at May. Thank you so much for joining us and welcome to May's Conversation That Matters. Tonight is a special edition as we conduct an exclusive screening of the documentary Laboring with Hope, produced by Dr. Nakeitra Burse. Then we'll have a quick conversation with Dr. Burse and a panel discussion that will include our very own clinical director, Dr. Michelle Owens, and Dr. Charlene Collier, who is also on our clinical advisory board here at May. To kick it off, I'll turn it over to the filmmaker herself for a quick introduction of the documentary. And then once that concludes, we'll go into the conversations. But first, just a quick introduction for those that may not be familiar with Dr. Burse. Dr. Burse is a native Mississippian, a public health equity, and social justice advocate, and the CEO and principal strategist at 6 Dimensions, a public health research, development, and practice agency focused on supporting better health outcomes for all people. With that, Dr. Burse, thank you so much for being here and sharing your work with us tonight. And now I'll hand it over to you.
All right. Good evening, everyone. And thank you all for having us this evening. I'm really excited to, number one, show the film, and then number two, share the stage with Dr. Owens and Dr. Collier. So I just appreciate this opportunity. As we prepare to view the film, I'll be sharing my screen shortly. But I always like to encourage people to take care of yourself. The stories that you see in the film are very close to me, close to my heart, and I'm sure that they will likely resonate with you as well. And so I just ask that you take care of yourself throughout the film. And with that, I will go ahead. Well, let me give you a little bit of background before we kind of go into this. Like I said, there was a big need for some storytelling, some trying to control the narrative around Black maternal health. And I'm not a filmmaker by trade. I guess by art and by passion, I have become a filmmaker. And so I just chose as a public health strategy to create a documentary. And I had the characters, so to speak, all in my personal network, which showed that this was such a big issue that needed to be addressed. And so that's just a little background before we get into the film and the discussion. I'll go ahead and share my screen now. I will go off camera once the film comes on. But if you have any issues viewing or hearing, please just type it in the chat and we'll be able to address it from there.
Wow, such a powerful documentary. Before we continue into the conversation, I just want to kind of do a quick reintroduction just in case some people have joined since we started, and then we'll kind of just jump right in. Does that work for you, Dr. Burse? Perfect. Yep. So again, I want to reintroduce Dr. Nakeitra Burse, who is a native Mississippian, producer of that powerful documentary we just watched, Laboring with Hope, and the CEO and principal strategist at 6 Dimensions, a public health research, development, and practice agency focused on supporting better health outcomes for all people. And then we also have Dr. Michelle Owens, who will be joining. We can bring her up as well. She is the director of Maternal Fetal Medicine at University of Mississippi, and she's also May's clinical director. And then we have Dr. Charlene Collier, who is the associate professor of obstetrics and gynecology at the University of Mississippi and a member of May's clinical advisory board as well. So yes, welcome, ladies. I want to go ahead and just kick it off and talk to you, Dr. Burse, about this film. You kind of shared a little bit before we went into the film about how a lot of the characters or people in the film were people that are in your personal network. Can you share a bit about the inspiration for the film and what it meant for you to create something that is really, extremely personal and a very important piece of work?
Yeah, and thank you all for watching. Um, so of course, my aunt, and I think I said in the film 2013, but I wasn't all I wasn't excited about being in the front of the camera. But in 2003, my aunt, my mom's only sister, she went in. I mean, she was 42. I mean, 40 weeks. I mean, full term pregnancy, no health issues. She went in, ended up having a C section, and everyone was advocating for her. As you heard in the film, my other aunt was a healthcare provider. My mom was in nursing school at the time, but her provider was a white man. And every time my aunt would say, "Well, let's look at this, let's look at that," no, 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 we have it under control. And so she, after about 5 days, they finally airlifted her to another facility. And at that time, it was too late. I was a sophomore in college, pre-med major, didn't go down that route. But so I didn't know what it meant to have a maternal death. I thought that this was a very, very unfortunate event. And so, of course, it stuck with me, and I tried to figure out how do I continue to honor her legacy. And so then back in 2016, my sister, early, you saw her in the film as well, had a very, very severe case of preeclampsia. And so here we were again, trying to advocate for a Black woman in the healthcare system. And it felt like, eerie nostalgia, not this, a good feeling. It was a very scary feeling. And her son dying after 8 months in the NICU, but she was extremely sick for a few days. And then that same year, you saw the little girl and my mother-in-law at the beginning of the film. Um, my sister-in-law was about 28 weeks pregnant. She went in for some pain. They did an emergency C-section, sent her home. She comes back um, with pneumonia, supposedly, and is on a ventilator for 3 weeks. So 26 years old on the ventilator for 3 weeks, and then, dying and leaving a baby. So that's two maternal deaths in my family, and then the case of infant mortality. And so I'm thinking, maybe this is a strange turn of events, but still around that time, we started hearing stories about Beyonce, Serena Williams, Allison Felix, Kira Johnson, all these names that have this national platform. And so I always think if Beyonce couldn't escape the system, then how can we? And as a public health professional, I like to kind of think outside the box. And so I was literally one day, I said, I was getting dressed, and I told my husband, I was like, I'm gonna make a documentary. And he was like, okay, here she is again with another harebrained idea. But I did. I went and talked to a producer and gave him my vision, and they brought it to life. We have kinks, we have glitches, but I think the message is there. The passion is there. These two amazing providers are there. And, even more that you saw in the film, and everyone that you saw continues to advocate for Black mothers, even up to the legislature. And so I think it was timely. That was 2019 when we started. COVID tried to stop us, but we still got an opportunity to share all across the country. And so, even in my novice as a filmmaker, I think the message has been consistent across the board. And so that's the story of it. And here we are.
That's amazing. And it's interesting because it's really an innovative way to kind of like raise awareness, right? And it's funny that you say that because you're like, I'm not a filmmaker by trade. And I don't think people really understand what it takes to put a film together. I myself, I have a background in like broadcast and journalism, and worked in the entertainment space for a minute. So I kind of have an understanding of like putting it together, but also understanding like when you want to solve a problem, like what we see with a lot of tech companies, when you want to solve a problem, or you want to like you're doing, raise awareness about something. Sometimes you do things that may be out of your comfort zone. And so that is so appreciated. But I would like to talk a little bit about how it came together, and what challenges did you encounter throughout that process. And then on the back end of that, talk about a little bit about what your hope is for those who actually have an opportunity to view it.
Yeah, so yeah, I said I want to produce a documentary, but how I treated it, because my trade is like in behavior and design and public health programs. I put goals to it. We wanted to increase awareness, continue the conversation that was already happening, but also impact policy, create training, and engage in research. So those were our four overarching pieces of this. And so, when people say, well, why don't you try to call Netflix, or, put it on YouTube, or these different avenues that people, have, I appreciate that. But because this issue is so personal to me, and then with my public health background, I didn't want to veer off of our mission of increasing awareness, policy, training, and research. And so that, I think that probably has been the biggest, challenge, is really standing your ground, and making sure the vision continues to come to life. But then what, of course, raising awareness, and we are continuing to talk about it. But some things that we're doing now too, we stay in that. We do still do screenings, but we have been really in the fight around Medicaid expansion in the state. We do a lot of work with our legislature, trying to talk to them about, this issue. So that's kind of our policy piece. And we don't do it just, I'm not just out here hanging out saying this, with my picket sign, but it's, a collaboration of people who know how to do it much better than me. And so I just go alongside of them in that work. And then we are currently creating a course that will be piloted in a School of Public Health and a Department of Health Science and Research. So public health, social work, aspiring nursing, and medical students will be able to take this. It's like a side-by-side course that we'll pilot for 2 years, and hopefully then, be able to put out for other professionals. And so that's how we have just kind of stuck to the mission. And so I hope that people who watch, depending on where you stand or where you land in your career and in your personal life, number one, just tell someone or share, you know, the impact of this bigger system on Black women. And so, and then advocate for someone or your family, because it's not just, it is our practice and what we do and how we do our work for us. But then there's the community that always says, well, how can I get involved? And that's being that sounding board and speaking up for someone when they don't have the opportunity to speak up for themselves. I'm thankful that my family was there, even for my aunt, because we know that we did every single thing that we could. And for all of my family members. And they still didn't, there were still glaring systemic issues. But, I do think that has been given to me as my mission, to make sure that nothing else like that happens to women, as far as we can prevent it, just from where we stand in public health.
Yeah, amazing. And you touch on my next question a little bit. And so if it's repetitive, forgive me, but I want to make sure I don't miss anything, because what's important is that there are a lot of things that you are doing outside of this documentary. That's just a piece of all the wonderful things you're doing, in this fight against, to reduce maternal health disparities for Black women, right? So I love to make sure we didn't miss anything, and for you to kind of share, like, what are all those different things that you're currently working on, whether that's with Six Dimensions or otherwise, to kind of let the audience know what those things are.
Yeah, so I did touch on a few things, but other things, I get to serve with Dr. Collier and Dr. Owens on the Maternal Mortality Review Committee. That's very, very important to me, from where I stand in public health, and as having gone through it with my family members as well. We do a lot of community outreach, and I have all my projects written on my board, so I'm looking off to see, make sure I don't miss anything. But one of the other big things that we do is we work with doulas, and when I say work with doulas, we really try to build their capacity to be able to serve in a career. So I know my lane. I'm not trying to be a doula. I'm not trying to step into any other arenas. I don't need any more jobs, but really try to help them build their business capacity. So we've started hosting like these business workshops for doulas and other birth workers. And we have a registry that will be building so that birth workers can, upload their information, and women and families in Mississippi can find a birth worker in their state, well, in our state. And that's it, and we work with women. We work with moms. Yeah, that's the most important piece. So partnering with the nonprofit organization Magnolia Medical Foundation here, we just work with 10 moms. They all came in last year. Everyone was right in their second trimester, I think, and the last person delivered right around Christmas. And so we tried to provide like a real close-knit supportive structure. They get access to a doula, mental health. We gave them a stipend, diapers, a wish list. So like their top 3 things on their wish list, we try to get most of those things, car seats, food, however we can just support them in services that they don't have to like try to go out and use their own resources. And just like to be able to connect them to whatever they need in that moment. And so I think that's one of the biggest things that we've done, and probably one of the most rewarding things, because we started, everyone would get on a Zoom call and everybody was cute and, like talking, and we would get into these educational sessions. And then as people started having babies, we came on with bonnets, we came on in our house coats, and everyone just, started, you could see the progression from, pregnancy to motherhood. And it was beautiful. But I will say that in that moment, several moms shared that even though we've been in this experience, we've been, kind of trained on how to advocate for ourselves, I still wasn't able to get the birth experience that I wanted, because I then kind of shrunk a little bit in that moment to what the provider said. And several mothers said that to us. And so that's still a persistent issue, even when we have these close-knit programs that, are really high touch. I was answering calls. A mom didn't, she was going to prenatal yoga and she couldn't get the code to the gate, and she was just crying. And I was like, hey, I don't know how to handle this issue, but let's just calm down. So it's those things that we just need. You need someone that you can trust, that that you can listen to. And so that's probably one of the other projects that I really, really enjoy working on.
Oh, that's beautiful. No, thank you. Like seriously, I always tell people that are doing this type of work, like it's hard work because it's hard work, but you do it because you really do care. So thank you so much for that. I want to shift the conversation to our panelists, just to talk a little bit about your experience. We want to talk a little bit about the film, and then a little bit about your experience in this space as well. Either one of you can answer, and I'll just start with the first one around the film. So basically this film, it was created a few short years ago, but of course this conversation about maternity and morbidity has continued to evolve since. What would you say are some changes that you've seen in the work you do since appearing in the film?
So, hi everybody. I'm Michelle Owens. I am the Division Chief of Maternal Fetal Medicine, which is high-risk obstetrics at the University of Mississippi Medical Center, and I'm also the clinical director for May. I think that's a really great question. And I think you saw Dr. Collier and I both laughed because I think our answer to that question is very mutual in a lot of ways. But I think, so first of all, there has definitely been a heightened sense of awareness within medicine in general about things that we can do to standardize care so that there's less of an opportunity for variation from one person to another who is struggling with the same or similar circumstances. Now, that being said, there's always room and opportunity for individualization of care. But I think as we have continued to hear messaging and not seen as robust of a change as we would like in our maternal mortality numbers, and also not really seeing the gap close with respect to disparities, there's been, I think, a significant focus on, well, what are the things that are harming people the most? And what things can we put in place systemically that will minimize variation from one person to the next? And also inherent in that is empowering other members of the healthcare team that interface with patients to be able to be important parts of the solution to those problems. So education on identifying those things and empowering them at various levels of the healthcare team to be able to initiate life-saving measures. So awareness about what those things are when somebody's looking really sick, and not to just be the person who's saying, hey, somebody's sick, what do I do? Like empowering them with things that they can do within their scope to be able to move things forward for that person. The other thing that I will say that has changed, and this is really a personal thing, is the conversations around systemic racism and bias and the acknowledgement of those factors on driving healthcare disparities, and also specifically as it pertains to underrepresented populations, especially Black people and Brown people in this country. And so while we are still not fully evolved, there has definitely been more conversation where we have been able to face some very difficult truths about the impact that systemic racism, implicit bias, you heard us use some of those terms in the documentary. And even then, I don't think we said it with as much force and power as if Dr. Burse was going to come and film that documentary with the two of us today, there would probably even be, I think we would be stronger and much more comfortable in those conversations than even we were to acknowledge them at that time. Not just that, but I think that there's a growing number of individuals who have become somewhat enlightened and who've had the attention, kind of the light bulbs are starting to come on. Now, by no means are we lit. We are not fully lit yet, but the light bulbs are starting to come on, and there are definitely more courageous conversations taking place than I can say have ever happened in my career.
Thanks. I definitely echo those statements. And I think my favorite line is just racism, not race. And that being really picking apart all the ways racism causes harm from every single, and that was that awakening after George Floyd's murder. And I think those conversations were like, full stop, we got to stop tiptoeing. You know, I was joking with Dr. Owens, it was implicit bias season back then when we were, and some folks feel like, some folks, those conversations were advanced at that time. They had already, you know, beat that implicit bias to a dead horse in their spaces, but that was not where we were even in Mississippi. Okay, those conversations were not happening in Mississippi, where the Confederate flag was still flying above my office, where we were just happy to be getting along, right? Like no one wanted to bring up these topics. So those were not conversations that were already picked apart, as they have been in many other academic institutions and environments. But, for now to be able to say, there's nothing wrong with Black mothers. There's nothing wrong with Black women that eliminating racism wouldn't fix. That's something like one of my heroes, Dr. Joya Perry says. But that acknowledgement all the way back to slavery, showing how Black women were treated, showing how birth was treated, looking all the way through, even as we're having this discussion around Medicaid, how Medicaid as a policy was formed, how just our entire health system was built around maintaining these structures of white supremacy and keeping, and how even now you don't even have to be racist. You can just have Medicaid policies that harm Black people disproportionately, which is what's happening in our state right now. We're not, as Dr. Burse and us, we're working on Medicaid extension. We have to name it and how racism plays into why those policies are not accepted, or why people don't consider that a policy worthy of implementation because of who they see is going to benefit from it. So I think that is one of the more clear, conversations that we're having, even in a state like Mississippi, where, that flag has come down since then. That flag is down, which is exciting to say that happened in that time, that's not flying above our heads as we go to work and have these conversations. But I think what it allows for is, when I was in medical school, if you take a pathology textbook, tobacco is throughout the whole thing. There's no medical condition where smoking is not considered harmful. I remember just saying, well, wow, if there was no cigarettes, my pathology textbook would be half as big because it affects cancer, affects hypertension, affects everything in health. It was always like tobacco makes it worse. That needs to be said of racism, right? Racism is a pathological entity that harms people. It harms health. It harms the health of populations. It causes chronic stress. It affects nutrition. So even all those things, kind of as we're looking at public health factors, like differences in education or obesity or heart disease, you can all tie it to chronic stress. You can all tie it to differences in opportunity to achieve health. So it's naming it and identifying it as a pathogen, as what is causing the harm, and as the thing that has to be corrected in order to see improvement. Is we can continue to try to deal with the symptoms of the problem, which are still important. I think reducing variation in care is important, because to me, I'm not all about changing people's hearts. I don't have time to change people's hearts around racism. I have to protect a Black mother today who's in the hospital, and I don't have time to worry about, is this person changing their heart and mind when they take care of her? We have to create systems that doesn't allow their racism or their bias to harm that mother. That has to happen now. And then the long work, of course, is eliminating those differences in people's perceptions and beliefs. But so it takes multiple levels to work on it. But I think that's kind of one of the things we always talk about, like the time difference between the film originally, and a lot happened since then. After that, I think we all see how much, after George Floyd's murder, how much changed in terms of the conversation nationally. So we feel that too in maternal health.
Yeah, that's very interesting. One of the things I'm interested in hearing about is kind of your day-to-day interactions in regards to patient care. So like, how do you kind of see this crisis or the maternal health disparities manifesting in your day-to-day interactions in patient care? And what do you feel like you as an individual can do or are doing, to address it?
Dr. Collier, you want to go first?
Sure. I'm happy to. So, I serve on the maternal mortality review committee. So I pick apart what happens when a mother dies. And I when I'm practicing medicine, doing obstetrics, I'm very intentional about identifying those things and trying to fill those gaps. And I'll never give up doing OBGYN or being somebody's doctor, because there's still that need to be an advocate, to love on and protect and be a voice for Black mothers. I'm very intentional. When my patients get admitted, I don't care if I can't be there. I'm on the phone. Everyone's going to know I care what happens. I'm going to check on what happens. I'm going to say, I want to know, and she matters to me. And I'm very intentional about that, especially for the people that often get overlooked, that people are like not trying to, like, oh, you know, there's this concept of VIPs in hospitals. I'm like, all my patients are VIPs. I want them all to be treated that way. But being available, being accessible, saying I care, I want, you know, you reach me if you need me, and I'm going to be there. So I think about Kira Johnson when I operate. You know, she died in her second C-section. That was supposed to be routine. So I take extra time almost every time when I'm doing a C-section. I look a little longer. You know, I make sure I check on how they're doing in the PACU. These are just the little things I do, but that we want to make routine, because I feel like it's a failure if individuals have to like overextend themselves to fill the gaps in the healthcare system. If you have to go above and beyond to keep somebody safe, that implies the system on its own would not keep that person safe. So if I have to go an extra mile to make sure a mom gets into the ER or that her blood pressure gets treated, and that still happens very often, that just is another reminder to me that the system itself, the healthcare system itself, was not going to do that. So it does definitely come up all the time. I love doulas. I love Black doulas. They are there with moms. They are filling in those gaps. They are watching for all those things that can help protect them. They're meeting needs that our healthcare system doesn't meet. Like, her bills are not getting paid. I'm trying to turn her lights back on. I'm making sure she gets the appointment. So I'm very grateful, and I'm very, I want every one of my patients to have a doula. And then, because I really feel like they are meeting the needs that really mothers really are going to keep them safe and protected. So it definitely is a daily reminder. And these narratives are so important that we gather from our mortality reviews. And we interview with every family. That's our intention in our program, because we know these stories are so important. But yes, I think hearing these narratives, like what Dr. Burse brought out with her film, definitely has a major impact on, and it should have a major impact on how we practice. If there's any doctor out there that's not thinking about these mothers, then that's the problem. You know, I think if you think about them, you'll change your practice. You'll do more. You'll take that extra mile. And so that's the kind of docs we need. That's the kind of midwives we need. That's the kind of nurses we need, that are willing to hear and empathize and change their behavior. So.
And I just kind of jump in. I think, loving on patients first and foremost. One of the things that I've noticed in my patient population is a lot of them have been just through so many difficult situations, whether it's, you know, exposure to earlier trauma or other things, or just the hardships of life in general. That just being able to take time and let them know that they can be your priority and that they matter is really important. I don't take for granted that just because I might look like some of my patients that they necessarily trust me, because I also realize that I also represent the medical establishment, and there's a lot of mistrust, and patients they're not going to fall for the okie doke. They can sniff out when you are not genuine. They can tell when you don't listen and when you don't care. And so I think that intentionality that Dr. Collier mentioned is something that's very important for me. And then one of our responsibilities working in an academic health center is that we are responsible for teaching and training learners. And those are learners, people learning to be doctors, people learning to be specialists, people learning to be nurses. All of those are opportunities that we have to teach and instill things. And one of the things that I try to focus on with my trainees is, you know, telling the whole story, and taking time to teach them about the importance of our words, and then also how, yeah, you might be smart, but you might not know her body. You're not going to know her body better than she does. Like, she's the authority on her. And so your job is to take what you know and to put that with what she knows, and for you guys to come to something together. I will say that over the later part of my career, I kind of have focused a lot more on the maternal experience, because the way that I was trained in medicine is, it doesn't matter what you do. If you have a good outcome, then that's a win.
Mm-hmm.
And what I started realizing is that, and we've seen today in the documentary, we've seen stories where there wasn't a win, right? We've seen stories of loss. But there are some situations where you may get a good outcome, but that experience for the patient is far from positive. And many women reflect back, many birthing people reflect back on their experiences, and they actually associate their birthing experience with a traumatic experience. It is traumatic for them, or they have traumatic experiences within their pregnancy journey, or within their birthing experience, or shortly after their delivery. And so trying to be in tune to that and creating space for people to share and acknowledge those feelings, and to try to acknowledge them and help them process, deal with, answer the questions, whatever, to kind of make that better. You might not be able to change what happened in that moment, but being able to acknowledge that it wasn't ideal, and how people can kind of move on from that, asking them about their fears. I mean, you heard reference to that before. I was anxious every single visit after I had had a complication in a prior pregnancy. And, a lot of people don't take the time to acknowledge the fact that, hey, this person's had 3 losses and they're coming in and they have a positive pregnancy test, and we want to bust through the door going, congratulations, everything's wonderful. And literally every single morning they're waking up wondering if today's going to be the day when I lose another pregnancy. And so being able to recognize that the person that you see in front of you is also kind of a summation of their experiences, and how those experiences not only influence how they view their pregnancy, but it should matter, and it should influence how we care for them, because we have to also acknowledge that as well. Because in many circumstances, those are innermost thoughts that many people are even afraid to share with those closest to them, because if you let it out in the air, then somehow you might bring it to fruition or give it life. Yeah. Or they fear judgment for what other people will think, believe, or feel about what they feel inside about their experiences. So that's been something else that has been a focus for me. And I've tried to help our trainees to see patients as whole people, as opposed to a diagnosis in a silo, like in some little vacuum space where all they are hypertension, or, the threatened miscarriage or whatever, but that this is a human being who has a life, and the life that they live, and the factors outside that influence their lives when they walk out this door are also influencing them while they're sitting in this office. And we kind of need to know about that, because it's going to impact their ability to partner with us. And it's also going to help inform us about how we need to care for them.
Yeah, no, thank you. Like, y'all really touched on like some really great things there. 3 things that stood out to me were intentionality, building trust, and education around the maternal experience, are all really 3 important parts of kind of seeing that change, come to fruition. We are a little over time. So to wrap, I just wanted to ask Dr. Burse, do you have any final words that you want to leave with the audience before we wrap?
Just briefly, I do want to thank you all for joining and having me on tonight. But also, I think Dr. Collier and I, we've talked about this a lot, like how the experience should be for Black women. I've traveled all over, looking at different opportunities, birthing centers, all of these other experiences that people who do not look like us get. And they're common practice and they're normal. And so I would just encourage everyone, whatever you can do in your space, try to make that experience great for Black women as much as you can.
Thank you. Thank you all so much. It was a wonderful conversation. We'll be in touch. Thank you. Bye.